Welcome back to the Bigger Than Birth podcast, where we're celebrating bigger bodies and beautiful births. I'm your host, Victoria Gaba, and each week we will be bringing you the real stories of plus-size moms as they share their journey through fertility, pregnancy, birth, and postpartum. These stories highlight what it's like to navigate through this experience as a woman in a bigger body in hopes of creating representation for plus-size moms, both present and future. Thank you for being part of this community as we share these stories that are so much bigger than birth. Hi everyone, welcome back to today's show. Joining us today is Sydney, a first-time mom whose path to motherhood took a sudden and high-stakes turn at just 30 weeks. After a very healthy pregnancy, a surprise pre-eclampsia diagnosis led to a month-long hospital residency where Sydney had to navigate the physical and emotional toll of living in a patient room while waiting for her daughter's arrival. Sydney shares the tough decision between a C-section and an induction, ultimately deciding to move forward with a planned 34-week C-section. After navigating a successful and peaceful cesarean, Sydney was faced with a long NICU stay for her daughter. She dives into the NICU experience and how the discovery of a brain bleed completely changed the care of her daughter moving forward. We discuss how Sydney is navigating the aftermath of that diagnosis through physical and feeding therapies and other monitoring of her daughter's progress moving forward. Sydney shares the importance of having a great medical team that you trust from the beginning of pregnancy to now going through the medical needs of her daughter. I hope you all enjoy this episode, and here is Sydney. Hi, Sydney. Thank you so much for coming on the podcast today.
Hi, absolutely. So happy to be here.
Thanks. So I guess we will get started. If you want to tell us and our listeners a little bit about you, your family, and where y'all are from.
Yeah, absolutely. So my name is Sydney. I am a first-time mom. I had my baby girl, let's see, 8 months ago now. It sounds so crazy saying that. My husband and I actually got married almost a year ago, so we're about to celebrate our first anniversary. We've been together almost 8 years, though. Funny, we met on Twitter, which is not even Twitter anymore, but whatever. We started our family and I'm super excited. We are from Texas. We're from the Austin area where I like to say we're in the suburbs of the suburbs. So kind of rural, but still close enough to all the good stuff.
Very cool. Very cool.
Yeah.
So that is great. And I know our babies are super close in age, which is super
Yes.
exciting. And we were talking, I think, on another comment about how we were thinking about moving them into their own rooms. So that's like a
Yes.
different stress in of itself, but we will get
Exactly.
to that part. So I
Yes.
guess let's start from the beginning. So were y'all planning to conceive when y'all did?
Yes. So I got my degree a couple years ago, and then I was kind of playing around with what I wanted to do with the future. I actually started a second program for another degree, and I barely missed the cutoff for one of my classes and failed by a super, 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 super small margin. And it's one of those programs that you can only apply to once a year, and there aren't very many similar programs in the area. So I applied again the next year and I didn't get in, which was not something I had planned for. So I, at the time, was 27. So, I'm not old by any means, but, we were wanting to start a family and we do want several kids. So I'm kind of thinking, now is a great time to start a family. So we kind of, had the discussion and decided there's no time like the present. So we planned. I had been on birth control for pretty much my entire adult life, and I had done some research on social media and kind of wanted to see what other plus size women kind of how if they had a problem getting pregnant, was it easy for them to get pregnant? And I kind of saw mixed information, but I guess I just kind of assumed that being plus size and also being on birth control for so long would make it hard to get pregnant. So we kind of prepared for that and amazingly got pregnant instantly. Um, which is such a blessing. And I know that that's not the case for everyone. So we are so, so grateful that that happened. But also, we were kind of unprepared. We're like, okay, well, this is happening.
Yep.
So we were super excited. But of course, we're like, oh, this is like actually happening right now. So yeah, so we got pregnant super quickly. And, kind of, I feel like the conversation had just started like, I don't know, 3 months prior. And then all of a sudden, I'm pregnant and we're starting this and there's no going back. So yeah, so that's kind of how things started for us. And again, super, super grateful that that was the case, but also very caught off guard.
Yep. I feel
So
like that is the case for so many because, like you said, there's such mixed messaging where, and especially I think doctors will sometimes tell women, like, oh, it's going to be really hard for you to get pregnant. That was very
yeah.
similar for us. I was like, oh, it'll be 2 years before we get
Yep.
pregnant. And we were about 2 or 3 months in of trying. And
Wow.
so, disclaimer for plus size women that are trying that it can
Yes.
happen very quickly.
Absolutely. Yes. No, and I totally agree. We actually met on a plus size group on Facebook. And I kind of looked at what, other moms what their experiences were, and lots of women were saying, "Oh, my doctor said because I'm plus size because this." And of course, yes, that, depending on lots of different factors, that
Mhm.
can certainly be the case, but yeah, I just thought that would be what would happen for us, and that was not the case. So, yeah.
So, to go through finding out you were pregnant, were you open to telling people pretty quickly, or did you wanna just kinda keep that to yourself for a little bit?
So we were trying and I was tracking everything. Again, I thought it was going to be very hard and time consuming and all the things. So I was checking the apps, I was checking ovulation, I was doing everything that you could possibly do. And I had symptoms pretty immediately. And since I was on birth control, my cycle and symptoms with my periods were super mild. So when I did experience pregnancy symptoms, I was like, this is not what I'm used to experiencing, but I don't know, is this a normal period? It's been so long since I've experienced this. But they were definitely like, I was so bloated and nauseous, just all the things. And I'm like, this is not normal for me. So I took a test immediately, and it was really nice kind of just having that to myself. My husband was at work, so it was just kind of nice being the only person in the world that knew that I was pregnant for, just a little bit of time. But yeah, so my husband came home, and since we were trying, I had like some little things picked out that said, like, hope- I think we had a onesie that said, um, I'm new here or baby or something to that effect. And so I had it like all spread out on the bed, and I told him I wasn't feeling well and I was in the room with the door closed taking a nap. So he came in and he's kind of like, "What is going on?" And he was just as shocked as I was, because of course
Yeah.
we both expected it to take forever and it did not. So yeah, so told him immediately, told one of my closest friends immediately, and then we told like our immediate friends and family pretty quickly. His family, my family, parents, I should say, his parents, my parents, best friends. And then we kind of waited till 12 weeks to tell more people. Again, just really trying to be careful, and we didn't really know what to expect. And I know lots of people that have had issues getting pregnant, and just wanted to make sure that everything was good, everything was healthy. And I also did not expect, I call my doctor and I'm like, I just took a positive pregnancy test. And they're like, great, we'll see you in a month or 3 weeks or something like that. And I'm like, but I'm pregnant, like, I think at least, like, how well can I trust these tests? Like, I don't and,
Yep.
so that was kinda shocking. I was like, "Are you sure you don't need to make sure everything's okay?" Like, and they're like, "Nope, we'll just, see you in 3 weeks or 4 weeks," or however long it was. So yeah, so I went in and everything was good, got all the tests, and then pretty early on, they recommended that I go to, a maternal fetal medicine doctor just solely based on my BMI. So I was always considered high risk, but throughout my entire pregnancy, I didn't have any issues. I passed the glucose test. All the scans, everything was fine. Yeah, so everything was normal, I guess, until it wasn't.
Yeah, and we'll definitely get into that. So,
For sure.
with you going into the MFM doctor, were your doctors treating you any differently, you think, because you were plus size, or were everyone pretty good about it?
Yeah, I feel like my experience was kind of unique because, like I said, I did a lot of research. I heard a lot of horror stories of how women were treated, just as plus size individuals, but also as people who are plus size and pregnant. So I felt very lucky that my doctor was super open and honest. And I asked all the questions, do I have any greater risk because I'm plus size? And is there anything I should worry about? Anything I should look out for? And I feel like my doctor was super supportive. I do feel like I could have gotten a little bit more education about things like preeclampsia, lots of things that do kind of come along with plus size pregnancies sometimes. Gestational diabetes, I fortunately did not have, but I also did not know what to look for, what that experience would be like. But as far as treatment, I feel like my doctors were super supportive. I feel like maybe I was a little bit more worried than they were, which was super refreshing because that is not always the case for plus size women. But yeah, my doctors were all super supportive. I feel like they, were telling me, yes, because you are plus size, there are some things we need to look for. And of course, you still want to be as healthy as you can be, go for walks and eat as healthy as you can be, which is pretty much always the recommendation for pregnant women. But
Yep.
yeah, I do feel pretty lucky that that was my experience going
That's
into it.
awesome. That's super good, and
Yeah.
I think there are so many doctors out there that I fortunately had that experience as well, where you have a really good doctor, but then there are
Yeah.
those outliers that you do hear about, and it kinda makes you like, "What are you gonna say to me, doctor?" But
Yes.
I'm glad you had a
Yes.
good experience as well.
Yeah, and I do feel like because we were planning, I was able to kind of ask around in like mom groups and things on Facebook, like what um OBs, not MFM. I'm like, what doctor am I talking about? Which
So
OBs
many
have
letters.
I know all the letters. I'm like, which OBs have you guys experienced that are positive around plus size pregnancies? Because I knew that that was something that I wouldn't be able to handle if, I was experiencing something that is the most exciting, happy, amazing thing of my life and somebody was just telling me I'm fat. Like I know the situation I'm in. I know I'm not skinny, but I'm doing the best I can and I still deserve to start a family. So
Yeah,
um
absolutely.
I was super, making sure like let me do the research, let me get a good doctor and I'm really glad I did.
I think that is a huge learning lesson for people that are either thinking about trying or that recently found out that they're pregnant is that you can shop around doctors. Like,
Absolutely.
you don't have, even if you go to your OB and even if you're a couple weeks in and they say something
Yeah.
like, you are always welcome to go look somewhere else. So that is
Yes,
a very good thing.
absolutely.
And ask people, like you said, that have gone through the same experience. So that's
Right.
fantastic.
Totally agree.
So, the rest of pregnancy, talk us through how the MFM appointments went. Were they just extra scans or were they talking to you about anything differently there?
Yeah, so they were mostly just extra scans. My baby loved moving. So we attempted the anatomy scan. I think it was like 4 times in office. And then, of course, when I was hospitalized, they, attempted more, but yeah, she did not want to be scanned. So they everything that they could measure was good. They just did every time I went, they did an extra scan, and then my baby was also measuring huge. So at some point, I was like, "So, at what point do we start talking about a C-section?"
Yeah,
Because
this is a big baby.
yeah, I mean, they were expecting her to be over 9 pounds. She was in, like, the 99th percentile, I think from, like, the 3rd scan on.
Oh,
So
wow.
she was always huge. So we did start talking about it, and they basically said, "If we expect your baby to be 8 to 9 pounds, it's up to the mom. If we expect your baby to be 9 pounds and bigger, we pretty much always recommend," I think it was maybe 9.5 pounds. We always recommend C-section just because of structure and,
Mhm.
the risk to the baby versus the risk to the mom, and so we had actually just started talking about potentially doing a C-section, which of course looking back, how things went down, it's like I kind of went into this expecting to have a choice and that's not always what happens. So, yeah, it's so interesting like kind of what you expect before going through it yourself and then you realize, there are lots of things that you have a choice on like picking your doctor and then there are lots of things that your baby decides or your body decides. So, yeah, I think looking back, I wish somebody would have told me, like, let go of the reins a little bit. You have lots of people who are looking out for you and your health, and, they're going to come together and make sure that you're safe and baby's safe. But yeah, so that's kind of how the MFM went. And I feel like I don't know about in other cases because I don't know a lot of people that, in my personal life that have gone to a specialist, but my OB and my MFM did a really good job at communicating with each other. They would send scans back and forth. And so I do feel like it was a collaborative effort, which was super helpful because, you hear like high risk and specialist. And, immediately when you hear that, it's like, oh, that's kind of scary. So it was really nice to kind of have a collaborative effort and everyone, like I said, make sure that me and my baby are both healthy.
Yeah, for sure. It was a team effort, just making sure everything was good, and the
Exactly.
communication part of, like, everyone
Yep.
knows what's going on and we're moving forward healthy.
Exactly. Exactly.
Very cool. So, I know a little bit about that kind of how things go next, but talk us through the end of pregnancy and then how labor kind of started for you.
Yeah, so I consider myself very lucky as far as most of my pregnancy goes. My symptoms were pretty immediate, but they were pretty mild. Like, I had days where I'd get sick but I've heard stories from friends who I feel like had it much worse. And I was kind of just trucking along. I mean, I was fine, everything was healthy. I did develop pubic symphysis separation, which was super painful. Um, so I was going to physical therapy for that, and the intense pain with that lasted about a month, and then I was starting to get better. So I continued to go to physical therapy, but it was more for like working on achy back muscles and things like that. And so, one night I'm going to bed, and again, in the Facebook group, this is the only reason I even knew what preeclampsia was. I had seen this is I should say is the plus size pregnancy group on Facebook. So I had seen lots of women post about preeclampsia, and the number one red flag is swollen feet. And I became used to seeing those posts on Facebook, so I kind of familiarized myself with that. Had no idea what it was other than what I had seen on Facebook. So I'm getting in bed and I kind of look at my feet and I'm like, wow, my feet look really big. And at this point, I was only 30 weeks pregnant. So I wasn't really to the point where, everything starts getting big and everything starts getting uncomfortable. So it was kind of like weird timing where it could be normal pregnancy, but it could be something different. So I'm looking, I press my thumb into my foot and my thumbprint stays there when I pull my finger away. And I'm like, this is not good. I remember seeing lots of women say this is the number one red flag. Other than that, I felt fine. So I'm like, I don't know. So I start messaging a couple friends who are nurses, and they're like, oh, you should probably get checked. Do you have high blood pressure? And the whole pregnancy, I had no high blood pressure. I was perfectly fine, no headaches, no nothing. So the next day, I actually had an appointment with my physical therapist. So I'm like, let me just go in. I don't want to pay the cancellation fee. They probably have a blood pressure cuff. Let's just see how things are going. So I go in, I kind of tell them, I'm like, my feet were really puffy last night. They're still really puffy. And I say, okay, let's take your blood pressure. Of course, every single blood pressure they cuff does not work. I'm getting like 200 over 150, which of course is like pretty
They're
much
like, "Get to the
not
hospital right
possible.
now."
Right. But then, like, immediately after, I'd get, like, 100 over 70, and we just all agree, like, these are not working. Like,
Yeah.
let's not count on these because clearly this is not happening. So, they're like, "Go to Walgreens or CVS and try one of those blood pressure cuffs that they have at the pharmacy." So I go. Of course, they don't have one. So I'm like, "Okay, let me just, relax, like, nothing is gonna happen immediately." I go home, call my mom, as we do. Call my mom and I'm like, "Hey, do you have a blood pressure cuff?" She comes over and my initial reading was like 180 over 110 or
Wow.
something like super high. Yeah. So we're like, okay, this is not great. So because I had the healthcare team that I did, I called my OB and I called my MFM, waiting to get in touch with both of them. And at this point, I'm kind of just waiting to see who I hear back from first. The OB said that they could schedule me an appointment for, I think, the next day, and then I could come in. And then the MFM said, go to the hospital right now. So I'm like, okay, those are very different
Right.
opinions, but I feel like we should err on going to the hospital because the worst that happens is they say you're okay and send me home. But if, I stay home and something happens, then obviously I won't be at the hospital.
Yep.
So yeah, so we decide to go to the hospital. At this point, I'm nervous. I'm not sure what to expect. I have heard of preeclampsia. I know that you get swollen feet. I know it's high blood pressure. Don't really know anything else besides that. I don't know how it affects me, how it affects the baby, how they treat it, nothing. So I go in, I get checked, they bring me to labor and delivery. They start running all the tests, taking blood, asking me how I'm feeling. I'm like, I'm feeling fine, but I have high blood pressure and I'm puffy. I don't know. So they start running tests, and we're there for about 3 hours. My husband's there with me. And at one point, the nurse comes in and she's like, "Okay, we just have to run one more test, and then we should be getting ready to discharge you." And I'm like, "Okay, I don't really know what that means, but I'm going home. So cool." So we're waiting for the test, and the doctor comes in and she's like, "So you're gonna have to stay the night." And I'm like, "What do you like? They just said I could go home."
Yeah, what's with these mixed messages I'm getting?
Exactly. And of course, I'm like, I don't know. I've never stayed overnight at the hospital. I don't know what to expect. This is my first pregnancy. Like, I just have like I said, no idea what to expect. So anyway, so she says we're gonna have to keep you overnight for testing at least one night, and I'm like, at least? What does that mean?
Like, that's not
So
comforting.
exactly. So now I'm planning, like, should I send my husband home to get a phone charger? Like, like what are we talking here?
And was that because of the last test, or they still hadn't run the last test that they were talking about at that point?
They hadn't run the last test. They just did blood pressure. I think they did labs at that point, or they were waiting on labs. I can't remember which one they were waiting for. But then I did, when the doctor came in, she said that they wanted to do a 24-hour urinalysis, and that would detect, I believe, protein
Mhm.
in the urine.
Yep.
So yeah, so that's why they wanted to keep me for 24 hours because it takes 24 hours to do the test. So yeah, so I was admitted, kind of, you know, nervous at this point. Not really sure what to expect still. And, they're at this point just kind of keeping me comfortable. I'm not really sure what we're waiting for. Like, at this point, like, I don't have a lot of information. So we go back to the hospital room, which, just for the record, was like, I felt like I was on a TV show. It was the biggest room ever. It was, I'm like, is this for me? Like, this isn't the VIP floor.
The
Like, it was
presidential palace of the hospital rooms.
totally, totally. It was huge. There's a huge TV, and I'm like, okay, staying overnight, no big deal. Like, I could totally get used to this, which in hindsight is really funny to say. But yeah, it was
Foreshadowing.
totally. So anyway, so we go back, I get comfortable, they take my blood pressure. At this point, they don't put me on blood pressure meds. They're just getting kind of base values and seeing, like, is this a spike? I think that's kind of where we were at this point, is just monitoring. So
Mhm.
they didn't, I guess, didn't really want to diagnose me with anything until they knew that, okay, this isn't just a spike, this is sustained high blood pressure. So I learned, as we're kind of going through this, that in order to diagnose, there's a couple things that you need for preeclampsia. So you either have the presence of protein in the urine over a certain amount, and or sustained high blood pressure over a certain amount. So at this point, like, I was getting close to where I had the numbers for high blood pressure that they would consider to be preeclamptic. But they just wanted to see kind of where my proteins were at as well. So, at this point, like I said, they're monitoring me, they're checking my blood pressure over several hours. And then, like, 11 o'clock at night, the doctor comes back in and she's like, "So, we're going to keep you until delivery." And mind you, I'm 30 weeks pregnant. So I'm
Yeah.
thinking, oh my God, I'm going to be here for 2.5 months. I have, again, no idea what to expect.
Right.
I look at my husband, I just start crying. I'm like, what does that mean? What do you mean I'm going to stay here till delivery? Like, she could have been speaking another language.
Yeah.
I was shocked, just pure shock. Kind of immediately after, she says that the goal is to make it to 34 weeks, and I'm like, make it? Like, what do you mean? Like, I was expecting to have a 40-week long pregnancy like everyone else. Like, I'm so confused. That's not full term. Like, there's, like you said, just so many questions that I
Mhm.
can't even formulate a question, because where do I start? Like, what do you mean? 34
Yeah.
weeks? That's so scary. And that's also in 4 weeks. Wait, I'm going to be at the hospital for 4 weeks. What do you mean? Like, just so many questions. So, yeah, so we just kind of started asking all the questions, like, what do you mean make it to 34 weeks? And that's kind of where they explain. At that point, they still hadn't diagnosed me with preeclampsia, but they were treating me as if I had preeclampsia. We were waiting for the urinalysis to come back. I, later found out that just my initial values that I came to the hospital with were enough to diagnose me with preeclampsia,
The protein
especially
values?
the high blood pressure,
Oh, okay.
actually. Yeah, so my urinalysis actually came back normal, or at least not elevated enough to be preeclamptic on its own, but they said just based on the high blood pressure readings I was having, that was enough. So they were like, "No, we gotta keep you like this is preeclampsia." So yeah, so I was admitted to the hospital. Of course, the first 24 hours is a complete whirlwind. I talked to all the doctors. So I talked to people from my OB team, MFM. I talked to somebody from the NICU, and they, tell me, so basically what this means is we are going to try to keep you from having a stroke. I'm like, that's great, but also, what do you mean? So I learned that basically preeclampsia is super high blood pressure in pregnancy, and if it goes untreated, it can lead to a stroke, which is why they want to keep you hospitalized and on blood pressure medicines.
Pause. After the episode, Sydney did want to make a note that while she was discussing preeclampsia and the risks of stroke, she also wanted to include that the risk they were monitoring was for seizures as well. So while you can have strokes or seizures with high blood pressure, she wanted to make sure that that was noted as a possible risk factor as well. Okay, back to Sydney.
So, of course, they did start me on blood pressure medicine. And the reason that they want you to make it to 34 weeks, but not longer, is because that's where the benefit to the baby and the risk to the mom kind of intersect. So, it is no longer beneficial to keep the mom pregnant because it's more risky to the mom. So, that's why 34 is the magic number. But because of how unstable preeclampsia is, you can pretty much be taken back for an emergency C-section at any point, whether you start having more symptoms or whether your blood pressure starts going up. So at that point, they basically say, like, you need to be low stress, not bedridden, and they definitely want you to get up and move around, but also take it easy.
How
So,
was emotionally so they tell you low stress, but then you also have that looming feeling of
oh,
it could
yeah.
be any time, so how did you manage, like, that situation?
It's actually I say funny because there's no other word for it, but, it's kind of funny that you mentioned that because pretty much immediately I had a panic attack, which, I mean, it's like one of those things that you almost can't prevent, but
Yeah.
also your logical side is telling you, like, "Don't do this, like, don't freak out," but you're like, "But I'm freaking
But your
out."
body is like, "Nope, I'm gonna freak out."
Yeah, yeah, exactly. So that's what I did. I freaked out and I have anxiety and I have panic attacks, but this felt completely different. And I think it felt different because of the added pressure of like, oh my gosh, now my baby's at risk. Like, this isn't just me. This isn't my body. Like, this is also my baby's body. And the difference between 30 weeks preterm and 34 weeks is a huge difference. So,
Mhm.
um, yeah, it was a lot of pressure. So at that point, like my oxygen started going low. And that's one of the things that could cause you to have a C-section, of course. So they put me on oxygen, they start monitoring me. They didn't tell me this then, but at the end of my hospital stay, they actually told me that the doctor that was seeing me that night actually did consider taking me back for a C-section. They were starting to kind of talk amongst themselves and were starting to prepare, like if I stayed, with low oxygen for X amount more time, or I
Yeah.
went lower, they were going to take me back. And I'm really glad they didn't tell me that because obviously it, it would have made me freak out even more. Um, but yeah, so like I said, I found out later that they were actually considering doing it right then and there, which is not what happened.
It is, like you said, the added pressure of everything, and then the knowing, like, I need to be calm, but I can't be calm, so that makes you more not calm, and so I that's a whirlwind for sure.
Yes, very much so.
So how did you go? So 30 weeks, you get admitted. I'm guessing did husband go home and pack some bags and say, "All right, here we go"?
So it's so weird because for the first couple days, we're kind of like, well, they say the goal is 34 weeks. So it kind of seemed like that's the goal, but, there's all these days in between, and, all these things can happen that can make you have a C section between now and then. So it seemed like we wouldn't make it to 34 weeks. And I don't know that it's they didn't say like you're not going to make it to 34 weeks, but they did say, preeclampsia is unstable and all these things can happen between now and then, and you can be fine one day and not fine the next day. And so at first we're kind of preparing like, am I going to make it 1 week? Am I going to make it 5 days? Am I going to make it 3 weeks? So as we're settling into this new reality, we're kind of preparing for the unexpected and kind of preparing for an emergency C-section. And as we're kind of getting more information from doctors and understanding it a bit more ourselves, we did kind of settle into, okay, I'm going to be living at the hospital for the next hopefully month. Which is kind of funny to say because nobody wants to be in the hospital for a month, but obviously I want the best outcome for my baby. And I think that's really what um, I focused on, that whole time is, this is super uncomfortable for me, but also super important to keep my baby cooking a little longer. So yeah, so he spent the night at that point, and then kind of the next couple days we're like, okay, we need to figure out what's the deal with work. Like, do we take leave right now? I had just started a new job actually, so I didn't qualify for leave, but I had like vacation time saved up. And then my company has a program where they like kind of gift new parents, I think it's 2 weeks paid if they don't qualify for maternity leave,
Oh, that's nice.
which was, yeah, amazing. So I had a total of 4 weeks paid leave saved up. But in the grand scheme of things, like I'm going to be in the hospital for 4 weeks.
Right.
So
And hopefully not
I'm
even
like,
have a baby, like, at the end of
right.
the 4 weeks, but who knows?
Exactly. Yeah.
Yeah.
So I'm like, do I use my time now while I'm not well and in the hospital, or do I use it when my baby's here? Of course, I want to use it while my baby's here, but also if my job says you can't work in the hospital, then that's that, which is also reasonable for them to say. Um, so yeah, so we kind of talked to our jobs and kind of, wanted to see what our options were. And we decided that because I work from home normally. So I talked to my boss and I said, look, this is the deal. I know this is a super unique situation and you may not have a lot of options, but this is what I would like to do. And I hope that maybe we can do that. And luckily, I work for an amazing company and have an amazing manager, and they let me work from the hospital, which is still something that blows my mind and I will forever be grateful for because I was able to take the time to be with my daughter after the fact. So I worked while I was in the hospital and timed my calls around doctors coming in and scans. And, there were times I'd have to mute myself while my baby was kicking on the monitor and things like that. But we decided that the best thing for us would be for me to continue working and then take my leave after, and then for him to take his leave when the baby came home from the NICU, because we did expect NICU time. They told us from the beginning to expect NICU time. Of course, they didn't really tell us, because you can't say,
Right.
3 days, 3 weeks, 3 months. So we decided, we have no idea how long she'll be in the NICU. So let's hold off on his leave because if she's in the NICU for 3 months, maybe he'll want to use his time to be there with her. So we kind of staggered our leaves, which was great for when the baby was home, but was also super lonely because I was living at the hospital kind of by myself,
Yeah.
Um, and it's one of those things where like I totally think it was the best decision, but also selfishly, like, I wanted my husband there, and I wish that we lived in a world where he could just take extended leave
Yep.
and get paid.
For sure. Yeah, that part.
Right? Yes, but that's not how the world works,
Yeah.
so, yeah, so, yeah, it was hard. It was really hard because selfishly, I wanted to go home, I wanted to see my dogs, I wanted to be in my bed. Nobody tells you how uncomfortable hospital beds are for a month and as a
Yes.
plus size woman,
Yep.
um, and pregnant, so I was at the hospital for a month. My husband came on the weekends and after work when he could. And then my mom also was able to take FMLA to come be with me. So I believe she took 3 or 4 weeks off. So she started after I had already been in the hospital for about 2 weeks. And then she continued 2 weeks after my baby was in the NICU. So she got to go to the NICU with me every day, which I needed so much because that is super hard. So yeah, so I had lots of support, which was really awesome.
People I feel like would think that working from the hospital would add to the stress, but it probably gave you a little bit of normalcy when you're there for so long.
That's exactly what it did, honestly, because, the first couple days while we were still figuring things out and we kinda, used some sick time and it was the weekend. I think, I went on, like, a Thursday, so, we had, like, 1 sick day each and then the weekend. So the first couple days, I'm like, "Okay, twiddling my thumbs, good to catch up on some shows," and then I'm like, oh my gosh, I'm gonna be here for quite some time, like and, it's not like I'm home, I can't catch up on laundry, I can't do the dishes, like, there's nothing to do, and, yeah, I mean, I can walk around the hospital, but that's about it, there's not I mean, there's only so much TV you can watch, and, yeah, I wanted to work, and, I have a fairly low stress job, so that was helpful.
That's good.
Yeah, and my team was super supportive, and they helped, offload some tasks if I was, getting overwhelmed or had too much work or whatever. But yeah, I needed a little bit of normalcy because there's nothing normal about being in the hospital for an entire month.
Moving forward, did anything become emergent and that's the next step, or kind of what did things look like moving once you were there for a while?
Yeah, so I think it was about a week into it, we started talking about options. And obviously, if I needed an emergency C section, I needed an emergency C section. But, I started asking the question, like, what if I don't need one? What if I get to 34 weeks? What does that look like? And so I was given two options. The first option was to do an induction where I could have my baby vaginally. But because I was so early and also it was my first baby, they prepared me, for, like, a 48-hour labor. So they said, "You could be in labor for 48 hours, and then at the end of it, there's still about a 50% chance that you'll need a C-section anyway,"
Mhm.
which to me sounds like a nightmare. I know
Yeah.
lots of women do it, but yeah, vaginal childbirth is already hard enough, and to add in potentially needing a C-section at the end of it and being in labor for 2 full days, yeah, that was hard, and then also, like, you can't get too stressed out because then it could affect the baby, and I'm like, "I don't know if this is the right choice for me."
Yeah, don't get stressed out in labor, please. You're
Right.
like, "Okay,
Exactly.
yeah, sounds good."
Exactly. So that was door number 1, and then door number 2 was to have a C-section, and, before I even became pregnant, I wanted to have my baby vaginally. Again, I thought that I could just choose, like, I could choose a C-section, and if there's an emergency C-section, what are you gonna do? But, I'm like, "Well, if I want a vaginal delivery, why can't I have one?"
Yeah,
And,
that's what I pick off the menu, please.
correct, and that was, of course, not really the case. So, we started talking about pros and cons, and my doctors were super supportive of me deciding what I wanted to do. They told me, kind of pros and cons, and they told me risks for each and kind of what that might look like. But they said, ultimately, if you want to have a vaginal childbirth, we will support you. We'll try it. We'll try everything we can to make that happen. My main doctor said, some women come to the table and they say, "I want a vaginal childbirth no matter what," and we do everything we can to make it happen. I felt like I wanted one, but I also don't feel like I was like, "I need this 100% no matter what." But at that point, I was kind of realizing that what I had in mind was not really on the table, and so that was really hard to digest. I expected having my baby and my mom and my husband being there with me and welcoming her into the world with my, 2 most important people in my life, and having skin to skin and golden hour and, all the things. I had my birth plan written out, and absolutely none of those things happened. Um, so yeah, so it was a little bit of grieving the experience that I thought I would have. And although, yes, I could have still had a vaginal delivery, it was very, very different than what I expected. And at the end of it, my daughter was going to go to the NICU, and that was definitely not on my birth plan. So I did a lot of thinking. I talked to a lot of people. I changed my mind a couple times. It was a very, very hard decision. And on one hand, I'm grateful that I got to be a part in making the decision and I wasn't whisked away to an emergency C section.
Mhm.
But on the other hand, it was hard sitting with that decision for 4 weeks. That's a long time to weigh the pros and cons and think about what about this? What about that? And
Yeah,
I don't really wanna be cut open, but I don't wanna be in labor for 2 days, like, I feel like both my options are not great.
yeah. Like the
Um,
lesser of two evils at that point.
Exactly,
Yeah.
yeah, and I mean, yeah, so,
Did they
um
give you a timeline to make that decision, or that was just kind of an open-ended option until we get to a point where a decision has to be made?
It was open-ended, and they told me I could decide up until it was time to give birth, really, what I wanted to do. They just, needed to book an OR if I wanted to do a C-section, so, I never felt like, you have to make a decision by June 4th or whatever day,
Yeah.
but they just wanted to make sure that I made the decision that was best for me, and I didn't feel pressured to make a decision, which I felt was super helpful, and I wish that they could have just said, "This is the best decision for you." Which
Yep.
of course they can't.
Yeah.
And there's so much more that goes into it. It's not just medicine, it's not just me, it's not just my baby. There's, all the emotions that come along with it. And like I said, grieving the birth experience that I thought I would have that I now wouldn't. And a lot of the things that I weighed were, if you have a C-section, you are more likely to have a C-section going forward. And I may never get to experience a vaginal birth. And so it's not only grieving this current birth experience, but potentially all my birthing experiences, but then it's like, I feel like that's probably the safest option and the least stress to me and the baby. And it's a very controlled environment. And of course, things can go wrong. Things can always go wrong. But, um, they kind of told me like if we plan and we know this is the day we're doing it, like things are calm, nothing's rushed. We, will you back and we get you on the it's very
Yeah.
calm and procedural. So ultimately, I decided that that would be the best thing to have the C-section. Yeah, it's one of those things I feel like birth, no matter if it's planned, unplanned, C-section, vaginal, natural, whatever, it's like it's hard. It's hard
Mhm.
no matter how you do it, no matter
Yep.
how involved you are. So, yeah, that's something that I have been talking through with a therapist and um, friends, and it's
Mhm.
something that I didn't expect, but this is my reality. These are my choices, and ultimately gave my baby the best shot. I feel like so. That's what we decided.
Yeah, absolutely. I know that couldn't have been an easy decision, and like you said, having that long to go through literally every scenario and change your mind back and forth, and the
Yep.
fact that you're not only considering your own health at that point, you are considering baby's health and of, like,
Right.
wanting to do the best by baby, but you have no way to predict what the next 4 weeks or 1 day will hold. So that is
Right.
a lot of pressure. I can definitely see that for sure.
Yeah. Yeah. And they told me, within a week of me being admitted to the hospital, we had a NICU doctor come in and they basically told me what to expect if I had a baby between 30 and 32 weeks. So they told me, at 30 weeks, this is what to expect. At 31 weeks, this is what to expect. But then as I started getting towards the end, I'm like, I don't know what to expect. And so, we had another conversation. This is what it'll look like. This is the approximate time your baby will be in the NICU. This is what they're going to have to work on. So, yeah.
That's nice that they gave you at least a little bit of a roadmap, so to speak, of, like, week
Yeah.
by week play. That's nice that you weren't just shocked of, "Let's go through this, and then what do we do?"
Right.
Yeah.
Exactly.
So, how far did you end up getting before they said, "Okay, it's game time"?
So I think it was about 2 weeks in that I made the decision, because at that point, I was I feel like I was exhausting my whole thought process. I'm like, I could go till the first day of the 34th week before making a decision if I'm well that whole time. So I ultimately decided like I need to have a game plan, and I wanted to make the decision so that I could start asking all the questions after that decision had been made. So once I decided I wanted a C-section, like I wanted to talk about, can I have a playlist going? Who's going to go back there with me? What are my options? Like I'm
Mhm.
picking off a menu. Like I just
Yep.
have all the questions, can I see my baby before they take her away? I needed to know everything that I could possibly know. So ultimately I decided like, I think it's one of those things that I could even, look back and say, would I have made a different decision? I don't know, but now looking back, I feel like I made the best decision. I feel like my healing was great, and I feel like it allowed me to see my baby and to be healthy enough to see my baby. So, I mean, I think I made a good decision, and
Absolutely. And the
yeah,
fact that it was able to be peaceful. So we'll go into that a little bit. Talk us through the day. Did they say, okay, you've decided you're going to have this C-section? Did you make it to 34 weeks?
I did. So as soon as they made the decision, they said, "Okay, let's kind of wait another." I think it was another week before booking the C-section. So they gave me, I think it was between a Saturday and a Sunday. I could decide one of those 2 days. Pick the Saturday because the next day was also Father's Day, and I didn't want it to be on Father's Day, and I wanted it also to be on a Saturday. Just kind of the start of the weekend is what I was thinking. Um, 'Cause then, my husband could be there Saturday and Sunday because he was still working. So, that's what we decided, and so they booked it. Yeah, so it was only a week, I think, before the actual C-section. So, at that point, we were preparing to go full term of, well, to 34 weeks until, unless something else happened, but, yeah, so I did. I made it 34 weeks. I had my C-section on the first day of the 34th week. Yeah,
And was your blood pressure up until that? I know they were monitoring it and giving you medication. Was it still pretty good or was there any concern there still?
yeah, so it actually I once they told me all the symptoms of preeclampsia, I realized that I actually did have a couple more symptoms that I didn't know were symptoms. I had a headache, I had some spots in my vision, which again, I've never been pregnant, and there are weird symptoms that come with pregnancy, and nothing really was consistent. So I thought, I just randomly saw a couple spots. Maybe that's pregnancy, maybe she's on a nerve or a blood vessel, I don't know, up until that point, so that I was on medication and they took my blood pressure, I think it was like 6 to 8 times a day, I mean, all times of the day and night, they took my blood pressure, and every once in a while, I would have a reading that was a little bit high, so I was well managed, and, at one point, I'm like, "So, since I'm so stable, like, am I gonna make it to 34 weeks?" And they're like, "It's not that simple." They said, of course, they've had people who have been stable, 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 and then all of a sudden they have to be taken back for an emergency C-section. So it's one of those things where you think you're stable, but stability doesn't really exist. So I, you know, just kind of took it day by day because each day could be different, but I was comfortable. I felt well. I was exhausted, but other than that, I mean, just I was fine, really. That's great. Yeah.
So the day of the C-section, so y'all decided, okay, we're gonna move forward with booking it in on this Saturday.
Mhm.
How did that morning go? What did it end up being like a pretty peaceful experience?
Yeah, so honestly, even before I was pregnant, pretty much from when I knew what an epidural was, I was terrified of an epidural or oh my gosh, I'm blanking.
The spinal block?
Spinal, thank you.
Yeah.
I'm like, what's that other thing?
Yeah.
Yes, I like a needle in the spine is like among my biggest fears in the world, but it's one of those things where I'm like, well, obviously I'm not going to feel them. The other option is to feel everything, which is not an option.
Right.
So yeah, so that was the scariest thing for me. And then of course my husband couldn't be there because it was a sterile procedure, which I'm like, "Ugh, I'm gonna have some random person," which she was an angel. But yeah, that was really scary getting over the mental hurdle of it. And then the physical was super, super scary. You just hear a needle in your spine and you're just like, oh, I
Yep.
don't but yeah, so they explained everything. They said, "We're gonna, put you in a wheelchair. We're gonna wheel you to the OR. We're gonna put you on a table. We're gonna, on." They went through the whole thing, and so I said goodbye to my husband at the door of the OR. Sure enough, I just walk in there, and they do the sterile dressing, and that was for me personally. That was the worst part was the spinal block. It wasn't as bad as I thought it would be, which is great. But it was super uncomfy and super nerve-wracking, and it's so weird, like, once it hits, it's just immediate, and I didn't expect that. So, yeah, as soon as it hits, they pretty much have to move for you because you're done, like, you can't feel
Yeah.
much of anything. So they put me back, and they start putting up the drape and unwrapping all the instruments, and I'm like, "Okay, this is really happening. If there's ever a feeling of not going back, it's now, like, this is
Yeah.
happening."
Did they
Um
let you have a playlist?
so they did, but it's so weird. I say that because I mean, my husband and I spent days coming up with, what kind of music do I want to listen to? I normally like this, but do I want this? Like, do I want peaceful? Do I want to rock out? Like, what if I move? Like, what do I want? I don't know. And
Yeah.
so we ultimately decided on Taylor Swift, which is funny because I'm not necessarily a Swiftie, but I'm like, you can't be upset listening to Taylor Swift music. It's
Yep.
just poppy and fun and, I might sing along. And so the funny part is once I got in there, I was not at all interested in the playlist. Like it was so weird. It's almost like, when you go to get dental work done and they put the laughing gas on, that like
Mhm.
euphoric kind of feeling. That's how I felt. And it's interesting because I was not on any kind of, hallucinogenic pain meds or anything,
Yeah.
but I think it was just the realization that the hard part is over. At least that's what I thought. The hard part
Yeah.
is over. And at the end of this, like, I get to see my baby, I get to meet
Yeah.
my baby, and at that point, I had already done the spinal. I'm like, "You can cut anything, I can't feel anything, I'm good." So, yeah, it's to this day, I mean, it's just one of those things I look back on and I'm like, I was at pure bliss. I was so, like, it's so weird. I don't even know how to describe it. It's just literally the best feeling because you're gonna meet your baby. Like, what is
Mhm.
better than that? And of course, I wasn't in pain.
Yeah, of
So,
course.
I'm just like, whatever. I'm just looking at the stuff on the walls and looking at all the people in the room. And I'm like, all right,
Yep.
well, just let me know when my baby's here, I guess.
Right. That's so special too, because like you said, it's such a scary thing for many people, but at the end of it, you are getting to meet your baby,
Yeah.
and for you especially, like you said, it was like that finish line that you were waiting to get to for all
Yep.
this time and thinking about how it would go, that you were
Right.
like, "Alright, here it is." So that's super
Yep.
special that it did end up being, like, peaceful, you didn't have to be rushed into anything, and that you got that moment of like, "Okay, I'm excited now."
Yes. Yep, absolutely, and like you said, I mean, making it to week 34, it literally was like crossing the finish line. I mean, it couldn't have been any more like that, and so every pregnancy moms are waiting to meet their baby and dads, of course, but I mean, I literally the nurses had a countdown on my board in my room, like 33 weeks in one day, and so, I mean, I literally that was the goal, like, there was nothing else to focus on except for getting to week 34, so that's all I focused on was
Yeah.
making it to week 34.
And you're like, "I'm here. We're in this operating room. I can't feel my legs, but we made it."
Yep, and I'm like, "And where's my baby?"
Yeah. How did they start? Was your husband able to be in the room at that point?
Yes. Yeah, so they kinda took a while to get him, and he said, like, he was kinda getting worried because they said, like, the whole thing is gonna take 20 minutes or something super short. It did not. But yeah, so they got him, they brought him back. I think he was a little more nervous than I was. I'm just high on life at this point. I'm like, "Whatever y'all can do, I don't even care. I might be able to hear my guts. I don't know. It's fine." But yeah, so he was up at the head of the table, and then when they got her out, she was not crying for a second, and he said that he could see her and she was blue. And so they were like doing sternal rubs, and it kind of took a second to hear the cry. And in all the movies where you're waiting for the cry, that's exactly how it is. That's all I wanted to
Yep.
hear in the world. And of course, as soon as I heard it, I started crying. I'm like, there's nothing better than this moment. But yeah, so a little scary for a second there. She did not want to breathe for a sec, but yeah, then she was good. And so he got to go. He didn't get to cut the umbilical cord because she was a preemie. So there were a couple things that he couldn't help with again that we expected him to be able to, and he wasn't able to, but he was able to take pictures and see her getting weighed. And there was a whole team of people from the NICU. I honestly don't remember how many people were in the operating room, but there were more than 8, and that was really surprising for me because I expected, like, my doctor and 3 nurses or, something like that. They, made sure she was breathing and she was stable. They put her on a CPAP. They brought her over to me, let me see her, and kinda give her a little snuggle. I had probably 2 minutes with her, which they did the best that they could to explain. And you don't know until the baby gets here how stable they are. And so they say, we'll let you have several minutes as long as the baby's stable. But ultimately, like they had to get her to the NICU and get her started on her treatments and all that. So I feel like that expectation, was good kind of coming into it. I know
Yeah.
I only have a second with her before she needs to be taken away. We didn't talk too much about, like, should my husband stay with me or should he go with the baby? For me, it was an instant decision, go with the baby. I'm fine. At this point, like I said, I'm high on life. Nothing could go wrong. Like, I heard my baby cry. I saw her. I'm good. Y'all do whatever you need to do. But he was sad. He wanted to stay with me and he wanted to support me. So he felt kind of like he was being torn in two different directions. But I told him, no, like, you need to go be with our baby and, go oversee her care. And so he still brings up to this day, he's like, I wish I could have stayed with you. And we know that it was the right decision. But of course, you wish you could be in two places at
Yeah.
once. Or even I wish, like, he could have tagged my mom in, tagged
Right.
someone to
That would
be
be
there with
so
me.
nice if they would let people do that, because then it's like I feel like that's most of the time the case. The mom is like, "Go with the baby," and
Right.
then you're just like, "Do." That was my case too. I'm just, like, chatting it up with the doctors and
Yep. I'm just kind of like looking around and
yeah.
I'm like, am I on Grey's Anatomy? This is kind of weird.
This looks like a TV show. So, you have the baby, get to see her for a little bit, and they take her to NICU. How was that experience with you immediately postpartum? Did they let you go see her pretty quickly, or did you have to go to recovery for a while?
So I went back to antepartum, which was the one with the presidential suite. So I went back. They told me beforehand that I would have to be on a magnesium drip for 24 hours and that I was going to be completely bedridden for 24 hours. I'd be on a catheter. Pretty much everybody that explained the magnesium drip to me told me it would be the worst experience, that I would be kind of like if I had the flu, just super sick and not feeling well. So I expected the worst on top of recovering from a C-section, but for some reason, I still don't know why, but it was not bad for me, which I'm super grateful for. It was fine. I mean, I had no issues. Honestly, the hardest part was not being on the drip, but was not being able to see my baby. So
Yeah.
I think I don't know why they took me off it early. I think my whatever levels they were looking at were good. So they took me off, I think, at like 21 hours. And they were like, yeah, we can take your catheter out and you can go see your baby if you want. I'm like, let's go. I'm like, I I want to see my baby. At that point, I had been FaceTiming. My husband went to see her and he would FaceTime me. And I'm like, no, I need to go see my baby.
Mm.
So yeah, pretty much as soon as I was off the drip. So I think it was like hour 20, 21. They put me in a wheelchair and took me to the NICU. And holy moly, I was not ready for that experience. That it's a whole other can of worms. At that point, I was pretty much just dealing with my own healing, and
Mhm.
then, it's always upsetting, just seeing her so small and hooked up to so many things was really hard. Like I said, up until that point, it was not all about me, but it was all about my care, and then as soon as she came, it was all about her, and I'm like, she's so little, and she needs all these things, and it was scary. It was
Yeah,
really
for sure.
scary.
How much did she end up weighing?
So she was still big. She was 5 pounds, 11 ounces at 34 weeks, so she came out big. Of course, I was expecting a 9 or 10-pound baby, so she's, was in preemie clothes and preemie diapers, so it was still very different than what I was expecting. I mean, even to this day, so she started in preemie clothes, but now she's 8 months old and she's in 18-month clothes. Even still, I'm like, I don't know if I expect her to be tiny or huge because I've had these 2 very different experiences with her. And part of me is used to the growth scans and her being huge, but then the other part of me is used to the preemie and they're just not matching up. So
So, was the concern her breathing, or were there any other concerns with her being that early?
Yeah, so when they talked to me about what to expect, it was pretty much exactly what they said. So they said she's going to be on a CPAP machine first, and then once she starts breathing well with that, they're going to put her on a nasal cannula and they kind of wean her off oxygen from there. And they also had her on a feeding tube. She was on vitamins or something. I'm pretty small, but basically they told us I think it was 32 weeks and earlier there's a high risk for brain bleeds. So, of course, when I was first hospitalized, they're like, okay, you're going to be here for a month. But if you have your baby, there's risk for brain bleeds, there's risk for this, there's risk, all these different things. And I'm just imagining all these terrible things happening to my baby and I'm like, "Oh my gosh." But then wait, we made it to 34 weeks, so now there's no worry of that. So now we're just worried about how much oxygen she's taking in and her learning to feed by bottle, and they said feeding would be the hardest part. That is very much true. She was stubborn and she was sleepy, so she was not interested. She's like, "Why would I learn to drink from the bottle if you could just bring it right to my tummy?" I feel like what they explained was exactly what happened. She was kind of ahead with everything. So she came off her CPAP really quickly, she came off oxygen really quickly, and then feeding was the thing that kept her there. So she ended up spending 32 days in the NICU. Um Around day 26, 27, we had a little bit of a change in her status. So one of her doctors said that she was a little bit worried about her head size. And she said, let's just do an ultrasound. Let's just check it out, make sure everything's okay. I don't think anything's wrong because she's fine. Like she's doing well with eating, she's doing well with breathing, she's doing well with everything she needs to do, she's doing. And I'm like, cool, let's just do the scan and make sure everything's okay. She has a large head. So they call me after doing the scan and they're like, so the ultrasound shows an active brain bleed, and my whole world shut down. I'm like, "What do you mean? Like, that's not," I wanna say not possible, but anything is possible, but they basically told me that it was not much of a risk at 34 weeks because it's just not common. Like, they
Right.
don't I think it's 32 weeks and earlier, they screen for them automatically because they're so common, and after that, they don't even screen for them because it's, just as common as anything else. So
Right.
they were not worried about it. So then they're like, "We're gonna take her in for an MRI and confirm whether it is or isn't an active bleed or what's going on." So they took her back within a couple hours. Of course, at this point, I was not at the hospital, so I rush over to the hospital. I actually saw them wheeling her to the MRI. I'm like, "Oh my gosh, it felt like a movie in her little incubator." And I'm like,
Oh,
"Oh my gosh." So they came back with results fairly quickly, which I am very grateful for. It showed that it was not an active bleed, but that there had been a bleed. So it's so weird because she had, like I said, no signs, no symptoms. Everything was perfect. The only thing that had them worried was her head size. So if this one doctor wouldn't have just said, let's just scan and just see what's going
yeah.
on, then we may have never known, or she could have had issues later on and then we would have found out. So, because of that, her care has changed quite a bit. We went from potentially not needing to follow up with a preemie specialist to now she needs to see a preemie specialist for the first 2 years of life. She has been going to physical therapy since she was 6 weeks old. So, once a week, every week since then. And then she also sees a neurologist. Like I said, it changed so quickly once I gave birth from my care to her care. But
Oh,
then now since the diagnosis, we were almost out of the NICU and they just threw this huge diagnosis at us. It just changes your world in an instant. So since then, it's just been all about her care. And they told us it's one of those things that, the babies' brains they're just going to continue growing for the rest of forever. So they are really good at healing because they grow so quickly and so much in the first couple years. So they said it could be as little as absolutely nothing. They said it's possible that you would have never known this happened if we wouldn't have done a scan,
yeah.
or it could be as serious as cerebral palsy. She could have learning difficulties. She could have motor difficulties. So, yeah, so it's one of those things where we don't know that there's an issue until she's not reaching milestones or she's having difficulties with things. So we've just been on the lookout for her missing milestones and doing things at different rates and things like that. And luckily she has a team of doctors that are all keeping an eye on it, but that's kind of where we're at right now.
Yeah, I know it's like almost through the whole pregnancy, it was like, okay, a wait and see game, and then
Yep.
this happens and it's another wait and see game, but
Yep.
now it's your baby, and so it's even more nerve-wracking, but she's been doing well, right?
Yes, mostly.
Yeah.
She yeah, so it's so weird because she other than learning to eat at the beginning, she has not had any issues with eating at all. Up until about 3 months ago, she randomly started choking on her bottles, which is terrifying. And so pretty immediately, I'm like, "Okay, this is a new thing that she's developed. I don't know what's going on." We didn't change bottles, we didn't change formula. So I told her doctor and they said, "Let's do a swallow study," but it took a while for them to get us in. So we just had that done 2 weeks ago, I think, and they found out that she was actually aspirating almost half of the time that she is taking a sip. So quite a bit. So we had to change her formula, we had to change her bottles. She also now has to go to feeding therapy. They also saw that she has a tremor in her tongue and low tone in her tongue. So, kind of at the same time, I asked the doctors, we're at about the time where she would start solids. Do we need to wait for the swallow study? Do we do it now? And all the
Yeah.
doctors said, no, you can try it. Sometimes issues with bottle feeding can be related to solids. Sometimes they have issues with one, but not the other. So we did, we started solids, and she, I thought at first she was not liking the taste or the textures. Um, and so she was gagging, like, I mean, you would think that you were putting, like, something nasty in her mouth. It was terrible, and I've never seen a baby react like that, and so we tried different foods, we tried different textures, we tried and it was not it was not helping. So I brought it up to the doctor, and of course, they tested it in the swallow study. And that's where they found when they said that she had the tremor and low tone, they said that what they think is happening is there's two issues. So with the bottle, the liquid is actually going into her airway and then coming back out and then going down the right passage. So that's one issue. The second issue is because she has the tremor and low tone, she's having issues feeling the food at the back of her mouth. So when she was actually eating the food, it would get to the point where she couldn't feel it, and then her body would basically protect her and kind of initiate the gag reflex because it's like, I don't want to choke, so it would
Yeah.
protect her. And yeah, so she does well if she like has a whole strawberry and she kind of munches on it, but the food doesn't actually get to the back of her throat. Like,
Mhm.
she's very interested in trying things and tasting them and nibbling, but she's not doing well with getting the food to the back of her mouth. So that's where the feeding therapy comes in. We haven't started that yet, but we're very interested to see kind of how that goes. And then since she's been going to physical therapy as well since forever, it's like I said, it's one of those things where when it's time for her to start sitting, we look, is she able to do it? Is she learning how to do it? Sitting was great. Rolling, not so much. She can roll, but she doesn't do it. She's done it maybe 3 times ever. And so now that she's getting more in tune with her body, we're noticing that she's not wanting to put pressure on her hands and her arms or on her legs. So that's
Mm.
the next thing that we're going to kind of investigate. And of course, I just have this looming diagnosis of cerebral palsy, which, of course, if that is something that she ends up having, we will love her just the same and we will do whatever we can so that she'll have the best life. But, as a mom, you don't want your kids to struggle. You don't want them to have to work hard to do the same things that other kids do. So that's been really hard for sure, is kind of adjusting my expectations and also the pressure that I'm putting on myself and the grace that I'm giving myself, acknowledging that this isn't my fault. This isn't her fault. It's just something that happened. And
Yeah.
now we're doing everything we can. We're taking her to all the therapists, all the doctors, doing whatever we can to help her have the best life that she could possibly have, regardless of any potential diagnosis.
Yeah, of course. And I think with everything you went through before birth and then now everything postpartum, I feel like it's so much pressure that you've gone through, but to be able to like have a beautiful baby and then the effort you are putting into her care now, like you said, it switched from your care to her care. I think
Yeah.
that just is like proving you're a great mom. And I think you are handling that super well and you are
Thank you.
doing a great job.
Thank you. I appreciate that. Yeah, it's hard and we just want the best for our kids and we want to do everything we can to give them the best life. So it's definitely been hard because I just want things to be okay.
Yeah, of course. And I really think it will be. She'll be great. She's beautiful. She's a
Thank
beautiful little
you.
girl. How was your healing? So I know you were dealing with all of the NICU stay, her health with you post C-section. How was your physical healing?
Yeah, so physically, I honestly, it was amazing. I in that Facebook group, I saw a couple moms mention that they had a wound vac and that really helped them. And I thought to myself, I was terrified of an infection. My mom actually previously had an infection with a hip replacement, so I know all about that. And that was like my biggest fear. I'm like, it's hard. That's hard. So I'm like, I don't want one. I don't want an infection. So I asked my doctor before the C-section. I said, "Do you do wound vacs? What does that look like?" She's like, "Oh yeah, no problem. We can totally do one." And I think that was one of the biggest things for my healing is I mean, it was amazing. It was comfortable. I mean, I had obviously had moments of pain, but I think the combination of the wound vac and also the um need to be there for my baby, I think the combination really helped with my healing. I mean, for me, it wasn't an option to not go to the NICU to see my baby. I had, well, I shouldn't say I had to stand up. Like nobody pressured me to stand up, but I wanted to change her diaper and I wanted to be involved in her care. So I did. I stood up early. To wash your hands for the NICU, you actually do have to stand up to wash your hands for like 3 minutes. And that was really tough at first, but I built up my stamina. So yeah, physical healing, honestly, I feel like was amazing. I recommend wound vacs. Like if any wound vac company wants to partner with me. No, I'm just kidding. But I love them. Seriously. I tell anybody and everybody, I'm like, if you're even thinking about a C-section, get a wound vac because I mean, I actually the battery on my wound vac was going out on day 4. And so I was expected to have it for a week. So I go to my OB and she's like, we could just take it off now. And of course, I'm imagining a huge gaping wound, my stomach open to the world. And that is not at all what it was. My mom came with me because I was terrified. And the doctor took off my wound vac, and it was, I mean, obviously wasn't fully healed, but it was closed. I mean, it was like a scratch. I mean, a big scratch, but yeah, nothing was open. I was fine. And I literally just on day 4, I was closed up.
I also had the wound back, and maybe that'll be one of our sponsors soon. But
Right?
but no, I think it helped so much because I was very nervous about that. So
Yeah.
I'm a big advocate as well.
Yes. Yeah. No, I loved it. That was super helpful.
So going through all of this, I know you've had quite the experience. Is there
Yes.
anything as far as resources or information that you would like to share with anyone that might be going through something similar?
Yes, I wish that more people knew about preeclampsia. I literally wish that when I went to the doctor and I said, "Hi, I'm pregnant," they said, "This is preeclampsia. You need to know about it." Of course, like I don't think that there needs to be fear around it, but I think it's very important to know what the warning signs are, know if you're more at risk. My doctor told me, in future pregnancies, I am more at risk for having it since I've already had it. And I think that's super important to know. Like I said, the spots in my vision, I had no idea were a sign of preeclampsia. Headaches, I'm a migraine sufferer. So I mean, I was like, okay, I have a migraine, no big deal. So yeah, I definitely wish that the warning signs were more well known. And I tell people about it any chance I get. I share on my personal Facebook page. I tell friends, this is what to look for. If anybody posts and they say, my feet are a little puffy, I'm like, please go check your blood pressure at the very least. Talk to a doctor, talk to a nurse, talk to somebody because yeah, my life changed in an instant. And luckily, I got the care I needed. The hospital I went to is an amazing women's hospital. They have an amazing NICU team. Like, I had wonderful resources, but that's not the case for everyone. So I think that it's very important as women and especially as plus size women to educate ourselves, know what the warning signs are, and know, who to talk to, who to ask. And where your nearest blood pressure cuff is. Either have a blood pressure cuff or know of a friend that has one or know of an old school Walmart that has one, but you need to know where they are because that could be preeclampsia.
That's good. I think especially knowing the warning signs, like you said, it doesn't have to be fear-based or this is gonna happen to you, but just knowing what to look for. So I think that's great. Well, thank you so much, Sydney. It's been such a pleasure, and I know your story will help so many other people to know the warning signs, and then also just kind of if they're going through something similar, have you and your story to relate to, and that you do have a beautiful baby at the end
Thank
of the
you.
day. And we just
Yeah.
hope y'all the best and that she continues thriving. And just, I really appreciate you sharing your story.
Absolutely. Thank you so much for having me and for having this platform. I think it's so wonderful for women to share their stories and plus size women because, before I even found the Facebook group that we're both in, I had no stories, nobody in my life to relate to. So, it's so wonderful that, you said, I haven't heard of very many people talking about their stories, so I'm going to create that space and I love that. So, thank you so much for creating the space and for letting me share my story.
Thank you so much for spending part of your day with us. If you enjoyed this episode and want more stories just like this one, please be sure to like and follow us wherever you listen to podcasts. Also, if you have a moment, please consider leaving us a positive review wherever you're listening to this show. These reviews are the best way for the algorithm to push out our show and get us in front of other plus-size moms who may be looking for a community like this one. Your kind words can help make sure that no one has to go through this journey alone. If you are a fellow plus-size mom and would be interested in sharing your story, please reach out to us at biggerthanbirthpodcast@gmail.com. Use the subject line "Share My Story" and I will be sure to get back to you as soon as possible. Want to put a face to a voice? Head over to any of our social media pages linked in the show notes below to see more photos of today's guest. Any resources or topics discussed in today's episodes will also be linked below. Thanks again for being a part of the Bigger Than Birth community, and we will see you next week. Bye!